Since the late 1800s, it's been a well-known fact that you need calcium influx if you want smooth and cardiac muscle to contract. Scientists have since discovered numerous types of calcium channels and, of course, ways to block them. By decreasing vascular tone, calcium channel blockers can reduce load on the heart, a useful effect when treating angina. And as you'll soon see, their ability to decrease vascular resistance and reduce contractility make calcium channel blockers some of the first-line drugs for treating hypertension. And you know, nothing eases the tension like a big, creamy, calcium-infused bowl of ice cream. I can imagine myself now, watching TV, eating right out of the carton, alone. The calcium channel blockers currently available for clinical use are specific to voltage-gated L-type calcium channels. And at the Calci-Yum ice cream parlor, we've got a few soft-serve machines in the back with some coincidentally L-shaped lever handles. Pull on one, and you've just initiated some tasty calcium influx, my friend. Voltage-gated L-type calcium channels are the dominant type in the cardiac and smooth muscle. And if you take a close look around the machines, you'll notice that they've installed some pretty intricate tile work, which should evoke an image of those non-striated smooth muscle cells found within the walls of blood vessels. And next to it, those branched striated fibers of cardiac muscle. The distinction between smooth muscle and cardiac muscle is important because it underlies the selectivity and clinical effects of the two classes of calcium channel blockers, dihydropyridines and non-dihydropyridines. Dihydropyridines and non-dihydropyridines will be represented by the signs for dairy and non-dairy soft serve, respectively. Notice that the dairy sign is displayed on that smooth muscle tile. That's because dihydropyridines have a greater ratio of vascular smooth muscle effects relative to cardiac effects. In other words, they are more selective as smooth muscle vasodilators and have less cardiac depressant effect than the non-dihydropyridines. I mean, just look at that big dilated nozzle as this guy reduces the resistance on that sweet dairy berry flow. The dihydropyridines, such as nifedipine, amlodipine, and nicardipine, all have that dipping suffix, so we've incorporated it into the sign above the toppings and dippin' station. We'll cover some clinical uses of the dihydropyridines in a little bit, but first, a quick introduction to the non-dihydropyridine family of calcium channel blockers. Represented by the non-dairy flavors of ice cream, non-dihydropyridines have a greater ratio of cardiac effects rather than vascular smooth muscle. Verapamil specifically exerts the greatest depressant effect on the heart, decreasing heart rate and cardiac output. And come on, if verapamil had to be an ice cream flavor, it would be very vanilla, of course. And our other non-dihydropyridine, diltiazem, will be represented by our flavor of the week, delicious dark chocolate. Diltiazem has intermediate actions. It effectively depresses cardiac muscle while retaining some vasodilatory effects as well. Hence, we've put it in the middle with that vasodilatory nozzle intermediate in size. Excitation contraction coupling in cardiac cells requires calcium influx, so non-dihydropyridine calcium channel blockers reduce cardiac contractility, decreasing cardiac output. This is depicted by this young ice cream lover here who's a little too weak to pull down the lever. Aww. Remember, however, that calcium is not just about contractility. Cardiac muscle relies on calcium influx during each action potential. Therefore, impulse generation at the SA node and conduction in the AV node, both calcium-dependent action potentials, may be reduced or blocked by diltiazem and verapamil. That's why, if you take a closer look at our enticing non-dairy sign, you'll notice that it's heart-shaped to emphasize that diltiazem and verapamil exert cardiac effects. But we've also included two notes where the two nodes of the heart would be, to remind you of decreased activity of both the SA and AV nodes. As a little extra reminder, we've included our recurring dangling heart pocket watch to convey the bradycardia caused by SA node inhibition. All right, let's talk clinical indications. Either through reduced vascular resistance or reduced cardiac output, both those dairy dihydropyridines and non-dairy non-dihydropyridines are equally effective in lowering blood pressure. See those high-pressure pipes ready to burst? It's our recurring sketchy symbol for hypertension therapy, And we've incorporated them into each machine to remind you that all calcium channel blocker classes can be effective. Usually, sustained release formulations or calcium channel blockers with long half-lives provide smoother blood pressure control and are more appropriate for chronic hypertension. In the acute setting, however, a dihydropyridine such as clofidipine or nicardipine can be administered IV in order to rapidly reduce blood pressure during hypertensive emergencies. And that's why we've included this emergency shutoff switch next to the rest of our dippings at our toppings and dipping station, of course. One of those dihydropyridines to keep in mind is nifedipine, depicted by this pregnant woman here using an unnecessarily large knife to cut up some fresh fruit toppings. She's here to remind you that calcium channel blockers are safe during pregnancy. Specifically, long-acting nifedipine has been used without major complications. Immediate release oral preparations are also available for emergent treatment of acute severe hypertension in pregnancy or postpartum. Alright, in the center of our scene, we're going to depict the clinical effects of calcium channel blockers used in the treatment of angina. And like always, to convey that characteristic chest pain and pressure, let's sketch in our recurring angina anvil. This time incorporated into the ice cream bowl of a reluctant participant taking part in a little contest being held at the ice cream parlor. 2 contestants, 5 minutes, and as many pounds of ice cream as the number of arteries you'll subsequently need bypassed. It's the annual Calcium ice cream eating contest! And I don't think he's gonna make it. I mean, just look at him. Clutching his chest in pain. What a sore loser. While it's true that beta blockers or nitrates should be used for the initial treatment of stable angina, a calcium channel blocker can be considered if there are contraindications or adverse reactions to either beta blockers or nitrates, or if symptoms are not well controlled with a combination of these agents. All calcium channel blockers are effective in the treatment of stable angina pectoris. And it looks like we have ourselves a winner! When treating angina, usually a dihydropyridine such as amlodipine or felodipine is started before other calcium channel blockers. Remember that smooth muscle tile, because these agents are actually able to vasodilate coronary arteries. This is depicted by her red coronary crown, obviously dilated and too big for her head. Dihydropyridine calcium channel blockers reduce coronary resistance, increase coronary blood flow, and may even enhance the development of coronary collaterals. Besides directly dilating coronaries, however, these agents also cause peripheral vasodilation, thereby reducing the pressure that the heart has to work against. This means decreased afterload on the heart, which reduces myocardial oxygen demand. A scale that reads load is our recurring sketchy theme for afterload, and our coronary crown champion has reduced the load, victorious and angina-free. The non-dihydropyridines, such as verapamil, also reduce angina symptoms. Instead of causing vasodilation, however, verapamil decreases myocardial oxygen demand by acting as a negative inotrope and chronotrope and by lowering the systemic blood pressure. This decrease in oxygen demand is depicted by her oxygen line, getting flung to the side as she stands to claim her prize. What's her prize, you ask? A medal, of course, here to represent Prinzmetal angina. Prinzmetal is a variant form of angina attributable to coronary artery vasospasm. The quality of the chest pain is indistinguishable from classical angina associated with obstructive coronary artery disease. However, patients with vasospastic angina report that their episodes are predominantly at rest, and many of these episodes occur from midnight to early morning. Calcium channel blockers are the first-line therapy for vasospastic angina. These agents prevent vasoconstriction in the coronary vasculature, thereby alleviating symptoms. Vasospastic angina may be associated with other vasospastic disorders such as Raynaud's phenomenon. See that man in the back wearing those cool fingerless gloves, obviously for providing utmost tactile perception when applying toppings? Well, if you look closely at his fingertips, you'll see that they're looking a little blue. Raynaud phenomenon is an exaggerated vascular response to cold temperature or to emotional stress, which manifests as sharply demarcated color changes of the skin of the digits. And he's at the dipping station to remind you of those vasodilating dipping agents. Dihydropyridine calcium channel blockers such as nifedipine or amlodipine can be used to treat Raynaud's that has not responded adequately to general measures. Combating vasospasm may also play an important role in the management of subarachnoid hemorrhage. Let's sketch in another customer going crazy with the strawberry syrup. Notice anything about his ice cream? Kind of cerebral, maybe? Let those succulent berry toppings evoke an image of berry aneurysms within cerebral vessels, prone to rupture, causing a delicious subarachnoid hemorrhage of strawberry syrup. On the exam, when you see blood in the subarachnoid space, remember that the most common cause of subarachnoid hemorrhage is the rupture of an intracranial aneurysm. They may also hint at the presence of berry aneurysms by mentioning a history of polycystic kidney disease. Remember, bubbles in your kidneys, bubbles in your brain. Days after a subarachnoid hemorrhage, ensuing vasospasm can lead to the delayed onset of neurological symptoms. The dihydropyridine nimodipine has been demonstrated to improve outcomes in subarachnoid hemorrhage and is the standard of care in these patients. Let this Niedmo-Dippin sign remind you of this agent, which is administered to all patients, ideally within 4 days. Nimodipine exerts vasodilatory effects on cerebral vessels, though the actual mechanism underlying its ability to reduce symptoms following hemorrhage remains unclear. Another clinical indication of calcium channel blockers is for migraine prophylaxis. So let's bring back our recurring sketchy symbol for migraine prevention, that awkwardly head-shaped bell. This time, getting rung by the eating contest referee, evoking that throbbing, unilateral pain we've all experienced at one time or another. Though there isn't much data supporting its efficacy, a calcium channel blocker such as verapamil is the first choice of many clinicians for preventive therapy. For the last clinical use of calcium channel blockers, take a look over at the wall, next to our non-dairy, non-dihydropyridine selections. This old-timey jukebox holds a few rhythm-inducing records, our recurring sketchy symbol for antiarrhythmic agents. SA and AV nodal tissues, which are mainly composed of calcium-dependent, slow-response cells, are affected markedly by verapamil and moderately by diltiazem. Thus, these agents decrease AV nodal conduction and are effective in the management of supraventricular tachycardia and in decreasing ventricular response to AFib or flutter. This will be covered in more detail during our sketch featuring the Type 4 antiarrhythmic agents, the Kelsey Yum Barbershop Quartet. Alright, let's finish off this delectable yet informative confection by discussing some adverse effects of calcium channel blockers. On the exam, remember a few of the most common side effects, such as headache, flushing, lightheadedness, and peripheral edema. This will be represented by our lightheaded patron here, who looks a bit overwhelmed by the extensive selection of toppings. He's collapsed in front of our dipping dihydropyridines because these effects are more common with the vasoactive calcium channel blockers. Peripheral edema is highlighted by his dilated, baggy, yet timelessly fashionable sweatpants that he wore just for the occasion. Development of peripheral edema is related to preferential dilation of precapillary vessels, such as the arterioles, which leads to increased capillary hydrostatic pressure and fluid extravasation into the interstitium. All this peripheral vasodilation can trigger hypotension, of course, leading to reflex sympathetic activation. This can manifest as a reflex tachycardia, especially in the more potent short-acting vasodilators such as nifedipine. Let's sketch in a young doctor called to the scene and busting out the old heart-shaped reflex hammer, our recurring sketchy symbol for reflex tachycardia. Yeah, I'm not sure I'd start with a neuro exam, but it can't hurt, I guess. Though reflex sympathetic activation is usually an unwanted side effect, it can potentially be useful when treating hypertensive patients who also have bradycardia. You know what? I'm sorry, but I just have to say it. I think now is a good time to take a moment and acknowledge how absurdly large that nifedipine knife was back there. I mean, it's just needlessly excessive. Compared to the rest of the dihydropyridines, short-acting nifedipine has a relatively high incidence of adverse side effects, including flushing, headaches, and that peripheral edema we were talking about. In fact, Because it's such a potent vasodilator, it can actually exacerbate ischemia in some patients by causing excessive reflex tachycardia. This prevents its use in patients with unstable angina or myocardial infarction. So you know what? Let's make that fruit she's cutting the shape of a little vulnerable heart, especially sensitive to nifedipine's adverse effects. Large doses of short-acting nifedipine have been shown to increase mortality in patients in the immediate post-MI period. So it's probably best just to give her some space and browse some of the other dihydropyridines first. Let's illustrate a few more side effects over on the non-dihydropyridine side. The major adverse effect encountered with verapamil is constipation, occurring in over 25% of patients. And that's why we've included a janitor here, taking care of some of the clogged plumbing left behind by one or more lactose-intolerant customers. Notice too that he's blowing some bubble gum. Well, this expanding gum will represent the characteristic gingival hypertrophy caused by verapamil. When choosing a particular calcium channel blocker for a patient, the decision should be made with the knowledge of its specific potential for adverse events, as well as its pharmacological properties. Dihydropyridine, for example, does not appreciably decrease AV node conduction, and therefore can be used more safely than verapamil or diltiazem in the presence of AV conduction abnormalities. See the sign that must be displayed, for legal purposes of course, at the entrance of the ice cream parlor? You'll see this sign from time to time in our sketches that involve drugs that depress the AV node. A little reminder to be careful when administering those non-dihydropyridines. Verapamil and, to a lesser degree, diltiazem are relatively contraindicated in patients who have conduction abnormalities such as heart block. Also, a combination of verapamil or diltiazem with beta blockers may produce excessive AV block and depression of ventricular function. Hence, the beta incorporated into the word block. Also, in the presence of overt heart failure, calcium channel blockers can cause further worsening of failure. This is due to the negative inotropic effects of non-dihydropyridines, as well as the increased sympathetic activity induced by dihydropyridines. Both bad for a failing heart with reduced ejection fraction. Take a look outside, and you'll find our recurring symbol for heart failure, our floppy, failing heart balloon. This time carried by this sad-looking kid here who couldn't make it in before closing time. Next time, kid. Next time. All right, let's sum up this sketch. The soft-serve machines have L-shaped handles because calcium channel blockers inhibit voltage-gated L-type calcium channels on smooth and cardiac muscle. Dihydropyridine and non-dihydropyridine agents are represented by our dairy and non-dairy options. Dihydropyridines work mostly on vascular smooth muscle, causing vasodilation, as depicted by the dilated ice cream nozzle, as well as the vascular smooth muscle tile around the dairy sign. These agents also end with that dipping suffix, hence the dippin station over on the left. Non-dihydropyridines have more cardiac effects than vascular effects, so our non-dairy sign is heart-shaped and sits in front of the cardiac muscle tile. Verapamil, our very vanilla flavor, and diltiazem, that delectable dark chocolate, depress cardiac muscle, causing decreased cardiac contractility. I mean, just look at that weak little kid struggling to get that calcium flowing. Compared to verapamil, diltiazem retains some of those vasodilatory effects, so that's why the diltiazem dark chocolate machine is located in the middle, with an intermediate-sized nozzle. Remember, too, that non-dihydropyridines also inhibit the SA and AV nodes, hence the two notes on the non-dairy sign. This leads to bradycardia, depicted by the dangling bradycardic heart watch, and decreased AV conduction, highlighted by the unblocked sign, reminding you of worsening heart block in patients with underlying conduction abnormalities. Also, watch out if they're already on another agent that depresses AV conduction, such as beta blockers. All right, let those high-pressure pipes remind you that all these agents can be used to lower blood pressure. A few of the dihydropyridines can also be used during hypertensive emergencies, hence the emergency shutoff switch next to our dippin station. Those dipping dihydropyridines can also be used to treat the cold fingers of Raynaud's phenomenon, and they've also been shown to improve outcomes after subarachnoid hemorrhage, depicted by that sweet hemorrhage of strawberry syrup. With all this dihydropyridine vasodilation though, Watch out for headache, flushing, lightheadedness, and peripheral edema underneath those sweatpants. This can cause reflex tachycardia, symbolized by the heart reflex hammer. In the center, we ring the migraine bell to indicate that calcium channel blockers can be used for migraine prophylaxis. And as our eating contest winner decreased that Advil load, remember that calcium channel blockers are used to reduce afterload, reduce oxygen demand, and relieve angina. Those vasodilatory dihydropyridines specifically can directly dilate those coronaries, hence the dilated coronary crown. Our rhythm-inducing record player on the right indicates that those cardioselective non-dihydropyridines can be used as antiarrhythmics. Verapamil specifically is associated with constipation and gum hypertrophy, both embodied by that janitor. And outside, we'll show that all classes of calcium channel blockers can worsen heart failure. All right, that's it. I'll see you guys later. I've got an ice cream eating contest to win. Yep, at home, all alone, between me and my emotions. Oh.